Most diabetic foot ulcers don't start in the hospital, they start at home. And almost every diabetic complication that results in an amputation starts with a wound that just would not heal. Hi, cousins, it's Dr. Kiki, board certified podiatric physician. And today we're going to talk about how ulcers really start and how to stop them. Welcome to Diabetic Footcare 101. Quick fact check. Did you know that 1 in 4 diabetic patients will develop a foot ulcer over their lifetime? This means it's not a rare occurrence, it's very common. Diabetic foot ulcers don't usually happen overnight. There's usually a predictable chain of events, and if it's predictable, it's preventable. It usually starts with loss of sensation. This is when you don't feel when problems start. Then comes pressure or friction that goes unnoticed because of the loss of sensation. It could be from shoes that are rubbing, it can be from pressure from a callus, it could be due to a blister where shoes are too big or something's rubbing like the sheets on the bed or the blankets on your toes. It can be caused by cracks in your heels from dry skin. All of these things can cause pressure or friction in a situation that goes unnoticed in a patient that doesn't have adequate sensation. Then over time, skin breaks down, and now the door is open. And if circulation problems are present, even small wounds struggle to heal. Having prolonged wound healing gives bacteria the opportunity to come in and cause an infection. So now what started out small is now dangerous. Infection, poor circulation together leads to tissue death. So now the goal changes from saving the foot to saving the person. This cascade of events is interruptible at many different points, which means the whole thing is preventable. The 4 most common starting points for diabetic foot ulcers: number 1, neuropathy; number 2, pressure; number 3, skin breakdown; and number 4, footwear. Let's break those down. Neuropathy is a situation where there's not a pain signal to make an alarm that something is wrong. So it could be that, for example, I've had a patient who put their shoes on and didn't realize that their grandchild had put a toy car inside the shoe and walked around with the toy car inside their shoe. Imagine the amount of pressure that put in, because that's not supposed to be in there. It caused a blister, which led to an ulceration, which led to other complications. Usually, someone who has normal sensation is going to feel that there's an object in their shoe and take the shoe off and remove their foot from that situation. But with neuropathy, those warning signs aren't there. Pressure. Pressure and, to some related degree, foot mechanics can cause things like calluses, bunions, hammer toes. It can be pressure at the joints. It can be pressure against the skin that causes calluses. If the toes are hammered, they may be rubbing up against the top of the shoe. All of those things are related to pressure, and just because it's always been there doesn't mean it doesn't need to be dealt with. If you have recurrent calluses, if you have recurrent corns, if you have bunions or hammer toes, you need to see your podiatrist so that we can talk to you about ways to treat those things. And it doesn't have to be surgical. We just want to prevent ulcerations. Skin breakdown can come in a variety of forms. It can be due to cracks in your skin from dry skin. It could be from scratching too hard. It could be maybe blisters that have popped and you didn't really notice it, or some people have skin conditions that cause their skin to get little pimple-like lesions on it, and those pop and start the skin breakdown process. Now, some of those things are not preventable. If you have a skin condition that causes, little blisters to form, you just have to make sure that you're taking care of that condition. You can see a dermatologist or even your podiatrist if it's on the foot. A lot of times we already know how to treat it and what to prescribe you. Now, one of the things is highly preventable. I've talked about this several times in several different videos, but dry skin can lead to cracks, can lead to openings, can lead to bacteria, that whole cascade that I just talked about. The easiest way to combat that is using something to moisturize your skin on a daily basis, even twice a day. My number 1 cheap recommendation is going to be Vaseline. There's other recommendations. You can look at my link in the bio. I have Amazon storefront that has several different collages that have recommendations for how to moisturize your skin. Moisturizing your feet is not optional. It's not just something you do in the summertime, especially if you have diabetes. Socks and shoes. You have to make sure that you're looking at the seams of your socks, the seams of your shoes, making sure there's not something that's rubbing, making sure that there's not a pressure point that's causing a callus or blister. Make sure that your shoes are properly fitted, that they're long enough, that they're wide enough, and that they're also deep enough. The depth of the toe box in the front is very important. That prevents, if you have hammer toes, it prevents the rubbing of the hammer toes against the top of the shoe. Make sure your shoes are not worn out. Once your shoe starts to wear out, the stitching can come apart. There's abnormal wear patterns that can cause pressure points on your feet and lead to those problems that we talked about. There's a very simple daily foot routine that can prevent a lot of these problems. And it's very, very simple. It takes less than 5 minutes. First thing you're going to do is look. Look at your feet, see if you see any abnormalities at all. Use a mirror. They have telescoping mirrors. Also, a part of my Amazon storefront. Telescoping mirrors if you can't pull your foot up to look at it directly. Also, if you have vision problems, you may have someone else do the looking for you. You can use your hands and touch to see if there's any abnormal lesions, anything that feels out of place that wasn't there before. Thirdly, moisturize. That's going to be part of your foot routine. Just make sure you're not putting moisturizer between your toes. You're going to make sure that your footwear is proper footwear. That is non-negotiable. What are some red flags that let you know that you need to see your podiatrist when you do your daily foot exam? Number 1, if there are any open lesions on your foot. Number 2, if there's any abnormal swelling on any place on your foot or your legs. Number 3, if you have any areas that are redder than usual. Number 4, ingrown toenails or pain that's been there for longer than a week. Remember, early care saves time, money, and mobility.